Community Assessment Project. Welcome. Our community assessment group chose to examine substance abuse services for Wake County community members. Our group chose the community members of Wake County because 5 out of 6 group members reside in the county. Additionally, Wake County has much to offer for the substance abuse population, which will be discussed later in the presentation. A windshield survey was performed by a group member of our selected community, including such aspects as availability of health resources, hospitals, housing conditions, schools, recreation, and alcohol and drug treatment centers. Actual pictures were obtained of the drive through various parts of the community. The housing conditions of Wake County are similar to those of other counties, which include single-family homes, apartments, rental units, low-income housing, homeless shelters, and halfway housing for former addicts. There are many different ways to travel through Wake County. The Wake County Transit provides bus transportation for community members traveling to work, school, medical appointments, and other key destinations for a cheap price of $1.25. There are also numerous taxi services, rideshare services like Uber and Lyft, roads and highways, as well as sidewalks for avenues of travel. In addition, Wake County houses a service titled Wheels for Hope, which provides donated cars for those in the local community who are ready to own and maintain a car. As shown above, there are numerous hospitals and health facilities that are each less than 10 miles from Raleigh, North Carolina. Wake Med is the largest hospital in Wake County, possessing a Level 1 trauma center. Holly Hill is located just behind the Wake Med Raleigh campus and provides psychiatric care and treatment for addictive diseases in children and adults. The Dorothea Dix campus, which closed in 2012, served as the hospital for mentally ill patients in Wake County and the surrounding areas. There are treatment centers specifically designed to help the less fortunate, such as homeless individuals, uninsured or underinsured, and substance abusers. For example, Healing Transitions is a place that helps homeless and substance abusers get back on their feet. One of the Planned Parenthood centers within Wake County provides low-cost care to those with and without health insurance. Project Enlightenment is a foundation that uses early intervention for young at-risk children to reduce teenage pregnancy, substance abuse, and dependency on welfare. Lastly, there are numerous assistive programs that empower individuals to find, change, or maintain meaningful employment in the community. There are many different schools in Wake County, including elementary schools, middle schools, high schools, alternative schools, and academies. There are also colleges such as Shaw University, Wake Tech Community College, Peace, and Meredith College. There are approximately 9 county parks, with some providing public access to picnic shelters, large charcoal grills, playgrounds, and tennis and volleyball courts. To protect the remaining greenways in Wake County, the Open Space Program is a working partnership that preserves the working lands like farms, forests, and landscapes. The community health is benefited by this program because of its contribution to flood prevention, clean water supply, fresh air, and fertile soils. Key Informant Interview. The Key Informant interview was performed by one of our group members who met with a case manager who is pictured above and is also a resident of Healing Transitions in Raleigh, North Carolina. This facility, called Healing Transitions, offers innovative, peer-based, recovery-oriented services to homeless and underserved individuals with alcoholism and other drug addictions. The following services are overnight shelter, non-medical detoxification, a social model recovery program, and outpatient services. The case manager at Healing Transitions stated the facility will be opening 2 more locations, one in Wilmington and one in Greenville, within the next year. Initially, these facilities will be open for men only. It is not uncommon for women to seek other options for care, such as prostitution, in exchange for money or shelter, more so than men. Therefore, more men are served at these facilities than women are, and are accommodated accordingly. However, the Raleigh facility serves both men and women. In fact, there are 180 beds for men and 90 beds for women. These beds room the homeless, substance and drug abusers, as well as those who have exhausted all other options. Winter time is when the facility is the busiest because people want to be out of the cold. Sometimes they have a waiting list of up to 45 people waiting to get in. 70% of the workers at the facility have been through the program themselves. Once they go through the program and graduate, they receive a phone call every day for the first month from the facility. After that month, they get calls weekly and then monthly. They stay in touch and have appointments with them up to 5 years after they leave. People also often come back to visit and check in. Our group member Sarah was introduced to a resident at Healing Transitions who provided her a tour of the facility. The following slide provides some background information the resident was willing to share. The Healing Transitions offers different services for those dealing with substance abuse. The short-term stay service provides a sleeping area for those who just need shelter and are not enrolled in the recovery program. This is basically a large room with bunked cots available to anyone. There is also a detox area staffed with doctors and nurses. The recovery program is a 12-step program in which residents who initially enter the program within the group are called MET1, which stands for Motivation and Engagement. While in this first group, the residents and participants are showing that they are committed to wanting help. They must attend a certain number of classes per week and complete their assigned chores within the facility. MET1s stay in a large room without technology or food of their own, and it is shared with many others. There are bunk beds in each room and small open closets which everyone shares in that room. There is also a hall, bathroom, and showers that everyone also shares. Once this stage is completed, the participants move up to the group called MET2s. Within this group, the same chores and responsibilities apply, but they get a little more space and privacy. Once that phase is completed, the next phase is the CTR1 group, or phase. These individuals have shown their commitment to recovery and continue to go to class, counseling, and show responsibility by continuing to do chores and take on more responsibilities at the facility. While in this stage, participants get more space, a bathroom that is only shared with 3 other people, more closet space, and a radio in their room. Once this level is completed, they move on to the final stage, which is CTR2. This is the final stage before graduating. At this time, they only share a bathroom and bedroom with 1 other person. They can have televisions, radios, and their own food and refrigerator in the bedrooms at this stage. They take the bus to meetings and take on jobs at the facility. CTR2s can work and get paid, but they must save 50% of what they earn and make budgets with their remaining money. This gets them ready to take on the real world and a real job. All of the food at the facility is made within the facility for the people living there. They must be up by 7 a.m. and breakfast is served between 7 a.m. and 8 a.m. They then go off to their meetings or class, which could be off campus. Lunch is packed for them, and then they return home for dinner, which is between 4:30 and 5:30 p.m. Phones provided by the facility may be used once you reach a certain part of the recovery program. They also have silver chip ceremonies every month. This ceremony occurs when people graduate from the program and they receive a silver chip. The names and phone numbers of the silver chippers are right by the phones so that residents can call them at any time if someone needs advice or help. Pictured on the left is a bulletin board which has the residents' assigned chores, mandatory meetings, schedules, and other information on it. Pictured on the right is of off-campus meetings that the CTR2s attend throughout the week. They have to go to 5 off-campus meetings per week. You will also notice the sign to the right that says, "Have you called your silver chippers today?" These are all over the facility, reminding participants to call and check on those who just graduated. They also keep a log of who was called so that they don't call the same person multiple times per day. The following are pictures of more of the Healing Transitions facility. The Commons area is pictured at the top left, which is equipped with a television and movies, sewing supplies, and crafts. You must reach a certain level of recovery before you can utilize this room. Pictured on the bottom left is a typical CRT2 bedroom. An open, quiet, peaceful outdoor space is pictured in the center of the slide. This area is also contains a playground and grill. Last, the two pictures on the right are of the boys and girls rooms for visiting children. If the residents have children, once they become a CTR2, their children can come and stay for the weekend. Initially, they don't want any family or children visiting, so distractions can be avoided. Secondary data analysis. One of our group members, Shannon Oliver, has a passion for substance abusers and performed a thorough assessment of Wake County public documents, health surveys, statistical data, and health records. According to the Wake County 2015 Indicator Report, there are approximately 24,927 persons residing in Wake County as of July of 2015. The percentage of the population greater than 16 years of age that is unemployed is 5.3%. The count of homeless individuals in Wake County is 904, which is decreased of 266 people from the previous year. The percent of households with no vehicle available is 4.4%, which has not changed since 2014. The teen birth rate per 1,000 females aged 15 to 19 is 23, with a national benchmark of 19 teens. 18% of Wake County residents admit to excessive drinking, which is an increase in 3% since the 2013 Indicator Report. Medication and drug poisoning are a growing concern for North Carolina. For instance, deaths related to drug overdoses increased from 363 to 1,306 in 2014. Prescription opioids contributed to greater than 50% of those deaths in 2014. In 2011, there were 79 heroin-related deaths, which tripled in the year 2014, with 253 deaths. Additionally, there were more than 11,000 hospitalizations in the year 2013 and nearly 22,000 ED visits in 2014, each related to drug poisonings. During the years 2009 to 2014, there were 1,287 heroin-related deaths in North Carolina, 109 of them of which were in Wake County. As you can see by the graphs above, heroin poisoning deaths are an increasing health concern for the community and the state. According to the North Carolina Institute of Medicine, substance use and abuse are major contributors to death and disability within North Carolina. To delineate this concern for Wake County community members, a Wake County Community Health Needs Assessment was formulated in the year 2013 with the inclusion of results from a Community Health Opinion Survey. The following statistics were discovered. Drug and alcohol abuse rated 4th for community concern. 15% of residents admitted to binge drinking, which is 5 or more drinks for males and 4 or more drinks for women. And in 2010, there were 140 residents served in treatment centers, which is 4 times the amount of residents that were served in 2005. The following table includes the ranking for mental health and substance abuse in the service zones of Wake County. The following slide shows information on the 2010 census data and the columns associated with the different age ranges of the census respondents, all from North Carolina. Respondents of the survey were asked about past illicit drug and alcohol use, abuse, and if clinical treatment was needed but not received for both illicit drugs and alcohol use. The following slide shows the detox facilities within Wake County and the short-term and long-term facilities within Wake County. The Oxford House is also another facility within Wake County, which is a self-run, self-supported recovery house program for individuals recovering from alcoholism and drug addiction. The current slide that we're on, as well as the following slide, lists outpatient substance and drug abuse services for Wake County community members and North Carolinians. Attached are the sites that describe the assistance provided at each location. All three data collection methods lead to valuable information regarding the community members of Wake County. Community health was critically analyzed to identify the biological, emotional, and social parts of substance abusers as evidenced by the data found in the prior slides. The biological portion of the community assessment includes the high-risk age groups and percentages of Wake County residents that engage in recreational drug or alcohol use. The emotional component of the health assessment was determined by the results of the Community Health Opinion Survey conducted in 2013. Lastly, the percentage of homeless and unemployed individuals reflect the social parts of the community health. Community health viewed from the structure of the community brought to surface the various services and resources Wake County has to offer. Some of the services include health facilities such as Duke Raleigh, Rex Hospital, Wake Med Raleigh and Cary, Holly Hill Hospital, and the neighboring treatment centers mentioned on the previous slides. Lastly, Wake County has multiple nonprofit agencies and resource guides available to the public, including access to healthcare personnel. For a community like Wake County to function effectively, following the community health process is essential to involve all key informants in creating the goals, priorities, and policies necessary to care for the substance abuse population. The process in successfully meeting the health needs of the substance abused includes the dedication of all Wake County resources and services that currently exist, effective communication among all community members, and participation and leadership among the powers that be. Community diagnosis. The overall health status of Wake County is considered a community strength. For example, Wake County ranked number 1 as the healthiest county in North Carolina in the last 4 years and number 1 in North Carolina for health outcomes. There were also high rankings in positive health behaviors, clinical care, as well as social and economic factors. Other community strengths include the mental health reports of Wake County residents. 3.2% reported poor mental health, but this percentage was found to be lower than the state average of 5.9%. Also, the suicide rate from 2007 to 2011 was 8.9 per 100,000, also lower than the state average of 12.1 per 100,000. Identified by community members in the 2013 Community Health Opinion Survey as a major component to personal health was spiritual well-being. 12% of members considered faith as a resource, which is easily accessible with the various churches and community organizations available to the public. Targeting churches or faith groups within the community is a pathway healthcare providers can utilize when bringing awareness to the public about the community resources that are available for mental health and substance abuse problems. For the year 2013, there were 299 licensed facilities with a capacity of 1,167 persons designed to treat and provide care for the substance abuse population. Examples include R.J. Blackley Alcohol and Drug Abuse Treatment Center, Alliance Behavioral Healthcare Facilities, Holly Hill, Wakebrook, The Healing Place, and Fellowship Health Resources Center. The following programs provide services that target substance abuse intellectual and developmental disabilities, mental health, detoxification programs, and psychosocial rehabilitation. Unfortunately, there are 12% of Wake County residents who struggle with substance abuse that are unsure of where to seek help. The North Carolina survey reports 201,000 respondents aged 12 or over that state they need but have not received illicit drug treatment, which is higher than the national average. This same survey also revealed that 476,000 respondents aged 12 or over state they need but have not received alcohol or drug treatment. However, this is lower than the national average. During the research process of Wake County resources available for substance abusers, a lack of treatment programs or centers for children and adolescents was discovered. As a baccalaureate-prepared nurse, attention must be brought to the community members regarding the prevalence of substance abuse and alcohol abuse disorders in those who are younger than 18 years old. Early education is key and must begin sooner than the current state's education protocols for prevention. Furthermore, exploration of age restrictions for treatment centers by the public health nurse can be evaluated. Proposals can be made such as parental consent for children under age 18 to receive treatment in adult programs if certain criteria are met. The North Carolina survey reports 26,000 respondents aged 12 to 17 years that have not received treatment for drugs and 18,000 for alcohol. This could be due to the inaccessibility of resources, especially for the young who are without income, transportation, and/or insurance. The baccalaureate-prepared nurse can take the opportunity to coordinate with homeless shelters and soup kitchens in providing information on treatment programs and resources for the substance abuse and alcohol abuse population. Representatives from different facilities can present treatment availabilities or provide informational flyers to raise awareness for countywide resource allocation. Another Wake County weakness includes the high prevalence of homelessness. In 2011, 1,150 homeless persons were sheltered or going unsheltered, with the majority of the group having substance abuse disorders. Alliance Behavioral Healthcare is a managed care organization providing public behavioral health care for children, adolescents, and adults of Wake County. Community Care of Wake County is a health resource portal within the Community Care of North Carolina network, which created and coordinates cost-effective and high-quality substance abuse care. Community Alternative Support Abodes develops and manages affordable housing throughout Wake County for citizens with very low income, those with mental or developmental disabilities, substance abuse, mental illness, and/or HIV or AIDS. During the research, it was difficult to ascertain county-specific statistics, especially on adolescent drug use. Many resources were geared toward treatment services for adults aged 18 or older as well. Second, there is more data needed on the specific locations that were identified as high-ranking priority communities within Wake County. Some of the data missing includes prevalence of substance abuse divided by age, income, gender, current local support or treatment centers, as well as written surveys, windshield surveys, and/or interviews with residents. Nursing interventions. The primary interventions for the adolescent age group consists of assisting them with developing lifelong skills, such as developing a sense of responsibility for their failures and successes, as well as aiding in skills to overcome peer pressure. Another primary intervention would be to coordinate with substance abuse programs within Wake County Schools District or school system, such as Project DARE and Poe Center for Health Education in Raleigh. Another primary intervention could be to increase the involvement in organizations and advocate for school health care clinics. The nurse will educate and/or assist both college and college students on the Alcohol EDU online course for primary interventions for college students, which is a mandatory class on alcohol required for all new students. The nurse can also develop non-confrontational programs to help students identify risks associated with their alcohol and/or drug use and ways to eliminate or reduce these risks. Lastly, the baccalaureate prepared nurse can also equip college students, such as resident advisors, with the knowledge and techniques to identify early warning signs of substance abuse and provide appropriate referral resources within the primary interventions for college students. For primary interventions for adults, the nurse can educate adult clients on the health promotion behaviors such as exercise, eating a well-balanced diet, and sleep. Education related to both prescription and recreational drug use is necessary, with emphasis on the fact that no drug is safe and can easily be abused. The nurse can assist the adult client in stress reduction activities and relaxation techniques. Lastly, education about the harmful practice of polysubstance use and abuse is necessary for this age group as well. For secondary interventions, the nurse will assess high-risk youth for substance use and abuse, such as victims of physical or sexual abuse, those diagnosed with ADHD, or addicted to nicotine. Project Enlightenment in Raleigh, North Carolina provides early intervention for children and teens who are classified as high risk. They also provide case management, health education, and consultation within the WCPSS nurse program. The nurse working with the Student Health Center of colleges can also assess for high-risk students by asking about the frequency of substance use, what the student is taking, and offer campus or community resources when necessary. During the secondary intervention stage for adults, the nurse will assess the clients for causative factors for substance abuse, such as history of withdrawal symptoms, socioeconomic problems, such as DUIs, job termination, legal or financial problems, or any history of using drugs or alcohol during pregnancy. Tertiary preventions for the adolescent group include Holly Hill Hospital admission for addiction treatment or smoking cessation programs. For the college students, the substance abuse outreach recovery programs within North Carolina are involved with all the major universities of North Carolina, including Wake County's North Carolina State, but it is not currently included in Wake Tech Community College. This program would be very beneficial for Wake Tech Community College since there are about 20,000 plus enrollments each year. The Collegiate Recovery Alliance program of NC offers 12-step recovery meetings, sober tailgating events, fun outdoor activities, recovery-focused career centers, career services, and support during final exams. As part of the North Carolina Substance Abuse Objectives for 2020, there is the Model Standing Order to authorize dispensing of Narcan by public health nurses at local health departments who choose to implement the 911 Good Samaritan naloxone access policy. Also, the nurse will provide this group with access to detoxification facilities, short and long-term facilities, and support groups such as Alcoholic Anonymous, Narcotics Anonymous, and Celebrate Recovery, which are available for all age groups. The topics learned from the Community Health Assessment of Wake County, with a focus on substance abuse services for residents within Wake County, include a geographical layout of Wake County services, opportunities available at filling transitions, substance abuse statistics, the abundance of treatment centers available within Wake County, the Wake County community strengths and weaknesses, and the interventions pursuable for baccalaureate prepared nurses. This also brought about the information that shows how influential nurses are in caring for those who are suffering with substance abuse problems.